This is Congressman Michael Burgess. Just watched the President's address to the country on health care reform. It is the 22nd of July, 8:45 p.m. Eastern Standard Time. The President is still taking a few questions, but I have another conference call to go join, so I thought I'd just offer a few observations and comments on what we've just seen. I think the most striking thing was there really wasn't much new that was discussed with all of the controversy that's been boiling up on Capitol Hill here the past couple of days about whether or not the Blue Dogs were going to stay in line, whether or not the freshman Democrats were going to stay in line. We really didn't hear much of the discussion about what has been offered, what has been labeled as off the table in the discussions. So we really didn't learn a whole lot more out of the most transparent administration that was ever supposed to be in existence. We didn't learn a whole lot more about what's been happening behind the scenes and what we might expect in the coming days. For example, my committee, the Committee of Energy and Commerce, was involved in a markup of this bill on Monday. We were recessed subject to the call of the chair on Monday evening, and we've not been called back. We've not been called back not because Republicans were obstructing this legislation, but because the Democrats were debating with themselves, and apparently no one could tell who was winning. We were told this afternoon to expect to be back in committee tomorrow. Then right before the speech started this evening, we were told that it would not be necessary for us to return to the committee markup tomorrow. So a lot of confusion up here on Capitol Hill as to what's going on. President Obama is very popular, much more popular than his Congress, and certainly if these are principles in which he believes, he must lead on this issue. But here it is the difficulty. These are big changes he's talking about making to an American healthcare system that, for all its criticisms, 60–65% of people like what they have. He said all along, if you like what you have, you can keep it. Well, apparently people do like what they have and want to keep it. Now that's being translated into defending the status quo. We do have some things that we could change, and here's the sad part. Republicans were willing to work with Democrats. I offered early this January, when I talked to Henry Waxman, the chairman of Energy and Commerce, I offered to go to his office, meet with his staff, talk about just the fundamentals of ideas. I was never asked back. I was brought down to the White House when they had one of their big rollouts on the healthcare reform. We had sort of some general discussions in a breakout session. No Republicans were ever invited back to the White House to participate in ongoing discussions with the Democrats. This has been a Democratic-driven process, at least on the House side of the Capitol. It's been a Democratic-driven process right from the get-go. They have been uninterested in our ideas, and now at the 11th hour, they're taking a few ideas as amendments in committee, but then even that process was shut down because it was getting a little bit too uncomfortable. Hard to know what's going to happen with this. I think some of the things we did hear tonight, President Obama did admit that a single-payer system would be his preference. He's not going to get that out of this legislation. I think he understands that. His Democrats in Congress would not support that. His Democrats are having difficulty even supporting some of the changes they're talking about making. If there's a rush, then really the smart thing to do would be to put a lot of these things to the side, bring people back into the room, and let's talk about where we're hitting the stalemate and how can we provide the relief. Say whatever the number is, the 6, 7, 8 million people who have pre-existing conditions, can't afford insurance, and want coverage. Why don't we tackle that as the first and most urgent problem? We're rushing this thing through in a very, very arbitrary timeline. We're supposed to have it all finished in really less than 10 days' time. And the answer is we may not like, if you like what you've got, you can keep it, but that may not be possible. And at the end, no one may like what they've got after Congress finishes with it.